Comprehensive Guide to Foot Drop. The video is created by Dr. Abhinav Gupta and team. In this video we have covered everything about the topic from initiation to the end. Foot drop or drop foot is a medical condition characterized by weakness or paralysis of the muscles that control the dorsiflexion, lifting, of the foot. This impairment can lead to difficulty in raising the front part of the foot, causing an abnormal gait and potential tripping or dragging of the affected foot. Foot drop can be caused by various underlying conditions, including 1. Nerve compression or injury, pressure on the nerves that control foot movement, such as the peroneal nerve, due to injury, trauma, or compression. 2. Muscle or nerve disorders, conditions like muscular dystrophy, peripheral neuropathy, or motor neuron diseases can affect the muscles and nerves involved in foot movement. 3. Neurological disorders, diseases such as multiple sclerosis, stroke, or cerebral palsy can impact the central nervous system and result in foot drop. 4. Spinal cord disorders, conditions affecting the spinal cord, like herniated discs or spinal stenosis, may lead to nerve compression and foot drop. 5. Injuries, trauma to the lower back, hip, or leg, which can damage nerves or muscles controlling foot movement. 6. Certain medications, some medications may have side effects that affect nerve function and contribute to foot drop. 7. Complications from surgery. In some cases, surgical procedures, especially those involving the lower back or leg, can lead to nerve damage and subsequent foot drop. In sciatic nerve injuries, the level of the lesion refers to the location along the course of the sciatic nerve where the damage has occurred. The sciatic nerve is formed by the combination of nerve roots from the lower spine, L4 to S3, and extends down the back of each leg. The common levels of lesion in sciatic nerve injury include 1. Lumbar plexus, L4-S3, damage to the nerve roots within the lumbar plexus, which contributes to the formation of the sciatic nerve, can lead to sciatic nerve dysfunction. 2. Sciatic nerve trunk, injury to the sciatic nerve can occur at various points along its course, including the hip region or thigh, affecting the nerve trunk. 3. Peroneal or tibial nerve branches. The sciatic nerve divides into two main branches, the peroneal, fibular, nerve and the tibial nerve, each serving different muscles and areas of the leg. Lesions can occur at these branching points. Understanding the level of lesion is crucial in diagnosing and managing sciatic nerve injuries, as it helps determine the appropriate treatment approaches. It's recommended to consult with a healthcare professional for a thorough evaluation if you suspect a sciatic nerve injury. Clinical features. 1. Difficulty lifting the foot. Patients may have trouble raising the front part of the foot, leading to a dragging or scuffing motion while walking. 2. High stepping gait. Compensation for the difficulty in lifting the foot may result in a high stepping gait, where the knee is lifted higher than usual to avoid tripping. 3. Foot slapping. The foot may slap on the ground when walking due to the inability to control the descent of the foot. 4. Toe dragging. The toes may scrape along the ground, and the person may have difficulty clearing the toes during the swing phase of walking. 5. Instability and tripping, increased risk of stumbling and falling due to reduced control over foot movement and placement. 6. Muscle weakness. Weakness in the muscles responsible for dorsiflexion, lifting the foot upward, can be observed. 7. Numbness or tingling. Depending on the underlying cause, there may be associated sensations of numbness or tingling in the foot or lower leg. 8. Loss of reflexes, reduced or absent ankle reflex, Achilles reflex, may be evident during a clinical examination. Investigations. 1. Clinical examination. A healthcare professional will perform a thorough physical examination to assess gait, muscle strength, reflexes, and sensory function in the affected leg and foot. 2. Electromyography, EMG. This test measures the electrical activity in muscles and can help identify nerve damage, muscle disorders, or other neuromuscular issues. 3. Nerve conduction studies, NCS. These studies evaluate the speed and strength of electrical impulses as they travel along nerves. NCS can help identify nerve compression, damage, or dysfunction. 4. Imaging studies. MRI, magnetic resonance imaging, useful for visualizing soft tissues, including nerves and the spine. It can identify issues such as herniated discs or compression of nerves. CT, computed tomography, may be used to assess bony structures and detect abnormalities in the spine. 5. Blood tests. Certain blood tests may be performed to check for conditions like diabetes, vitamin deficiencies, or inflammatory disorders that could contribute to nerve damage. 6. X-rays. X-rays may be used to assess the bones and joints in the affected area, especially if there is suspicion of fractures or other skeletal issues. Special tests. 1. Tinal sign. The healthcare provider taps along the course of the affected nerve, such as the sciatic nerve, to assess for tingling or electric shock-like sensations. A positive tinal sign may suggest nerve irritation or compression. 2. Babinski reflex test. This neurological test involves stimulating the sole of the foot to observe the response of the toes. An abnormal response, such as the toe spreading and the big toe moving upward, can indicate neurological dysfunction. 3. MRI neurography. This MRI technique focuses on imaging nerves and provide detailed information about nerve structure and potential abnormalities, helping to identify nerve compression or damage. 4. Dynamic ultrasound. Ultrasound imaging may be used dynamically to assess nerve movement and compression during various joint positions and movements. 5. Nerve biopsy. A biopsy of the affected nerve may be performed to examine it under a microscope. This is typically done if a nerve disorder, such as peripheral neuropathy, is suspected. Treatment. 1. Identify and address underlying cause. Medical evaluation. Consult with a healthcare professional to determine the specific cause through clinical assessment and diagnostic tests. Manage underlying conditions. Treat any medical conditions contributing to foot drop, such as diabetes, nerve compression, or inflammatory disorders. 2. Conservative measures. Physical therapy, strengthening exercises, gait training, and stretching can help improve muscle function and coordination. Bracing and orthotics, ankle-foot orthoses, AFOs, or braces may be recommended to provide support and help control foot movement during walking. 3. Electrotherapy. Functional electrical stimulation, FES. This involves using electrical currents to stimulate weakened muscles and improve foot dorsiflexion. 4. Surgical interventions. Nerve decompression surgery. If nerve compression is identified, surgical procedures may be considered to relieve pressure on the affected nerve. Tendon transfer. In cases of severe muscle weakness, tendon transfer surgery may be performed to reposition tendons and improve foot movement. 5. Rehabilitation. Ongoing physical therapy, continued rehabilitation to maintain and improve muscle strength, flexibility, and overall function. Adaptive strategies. Learn adaptive techniques and strategies to cope with challenges associated with foot drop in daily activities. 6. Assistive devices. Orthopedic shoes. Proper footwear can provide support and stability. Mobility aids. Consider using canes or walkers to enhance stability and prevent falls. 7. Regular monitoring. Follow-up assessments, regular checkups with healthcare professionals to monitor progress and adjust treatment plans as needed. Complications. 1. Risk of falls. Difficulty lifting the front part of the foot increases the risk of tripping and falling, potentially causing injuries. 2. Gait abnormalities. The altered walking pattern associated with foot drop can result in gait abnormalities, affecting overall mobility and stability. 3. Muscle atrophy. Weakness and lack of use of certain muscles can lead to muscle atrophy, shrinkage, affecting the overall strength of the lower leg. 4. Joint stress and pain. 5. Reduced independence. Foot drop may limit one's ability to perform daily activities independently, impacting overall quality of life. 6. Skin issues. Constant dragging or pressure on the foot can lead to skin abrasions, ulcers, or calluses. 7. Functional limitations. Vote of thanks. Thank you for watching our video. We hope this information has been valuable to you. If you have any further questions or concerns, please consult our team for personalized advice.